Thank you for joining us here on the KMR Local 4 News. The city of Amarillo is preparing about the coronavirus pandemic. We're taking you there live with this breaking news.
Supplies. We're going to increase our testing drastically this week. So with that, we're going to see additional positive test results. Our numbers are going to continue to go up, Amarillo. But that's good in that it's giving us information about who has the virus and how we can do more contact investigations and just have better information about how it's spreading through our community. So a lot of things are changing and plans are developing even as we speak, and we'll do our best to keep you informed about that. But I am grateful that we have help coming from the state government and the federal government to help us address our problem here in the city. That's all I have. Thank you.
Thank you, Mayor. This time I want to go to Casey Stoughton, Public Health Director for the City of Amarillo.
Thank you. As of Sunday, May 3rd, there were a total of 1,097 cases of COVID-19 reported in Potter and Randall counties. 818 cases in Potter County and 279 cases in Randall County. We have a total of 139 recoveries, which we're thrilled about each and every recovery. There are a total of 12 deaths reported in Potter and Randall counties, and that leaves us with 946 active cases in our community. The numbers reflected on the 230 report card will reflect information reported today. Please again remember to wear your masks if you have to go outside your home. My mask protects you and your mask protects me. It's important that we stay in our homes as long as we can. If you do have to get out of your home, please remain 6 feet from others and wear your mask. Hand washing is also important. Please don't go to work if you're experiencing symptoms of COVID-19. If you're sick, please call your doctor. Stay home unless you need to seek medical care. If you're experiencing symptoms of your chronic health condition, please reach out to your physician. And if you're well, please consider donating blood through the Coffee Memorial Blood Center. Our drive-through testing continues today, provided by Amarillo Public Health and Texas Tech Health Science Center. Testing continues today until 3 p.m. Please call 378-6300 and our call takers will screen and direct you to testing. We look forward to working with the team at CDC and Texas Department of State Health Service in the coming days. We will be part of a joint team looking at plans and strategies to slow the spread of COVID-19 in special populations in our community, and we're pleased to be part of this team.
Thank you, Casey. Thank you. This time we want to go to Dr. Scott Milton.
Yes, good morning. I'd also like to reiterate the importance of social distancing, wearing a mask when in public, and trying to avoid grouping and congregating. I've rounded the hospitals this morning, and it appears that things are still running smoothly, although they remain busy. I think it's fair to say that the capacity for ventilator use is still about 50%. I don't have all the specific numbers available this morning. They're continuing to test quite a bit, and there are still some testing that are confirmed. BSA pointed out that they have 57 tests that are still pending from their internal testing. In terms of transfusion of convalescent plasma, that program continues to be active, and we're up to 26 units transfused, and that's all I have to say.
Thanks, Dr. Milton. And I want to go to City Manager Jared Miller.
All right. Thanks, Dave. Even though businesses have partially reopened as part of the Governor's Executive Order GA-18, our public calls for service are still experiencing a decrease over this time last year. Part of that's due to last year this time was somewhat busy, but it does still reflect that people are being a little bit more being responsible as they're out and about. Obviously, we saw an increase in people out and about this weekend. We knew there would be a pent-up demand after many weeks of sheltering in place. So I just want to encourage people to be safe as they're out and about, wear their masks, as the mayor and Casey and Dr. Milton have said already. AmarilloAlerts.com is a reminder the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. I want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com. As of this morning, we have 5,418 people that have signed up. So thank you for doing that. Keep on doing it, and it'll just give us one more way to get fact-based information out to you about timely or emergency events. Our testing center, as Casey mentioned, last week we had our biggest week testing so far at the drive-through testing center. We had 726 people tested. Additionally, the National Guard tested 200 more on Saturday and Sunday. As a reminder, the drive-through testing center remains open. If you feel sick and have symptoms you think might be COVID, call Public Health at 378-6300 to be screened for a drive-through test to attend the drive-through testing center. Pet Pantry, last week we served 891 people with the Pet Pantry, which was relocated to Thompson Park in order to address some traffic safety concerns. This was our most successful week yet. It's going to continue this week, opening tomorrow and Thursday, so Tuesday and Thursday from 3 p.m. to 6 p.m. I want to continue to voice my appreciation for Merrick Pet Care for the partnership and donating all the food necessary to provide this program. Just as a interesting fact, they've donated over 15 tons so far for this effort. So thank you again to Merrick Pet Care. Update on state executive orders. We are currently still under phase 1 of the governor's plan to reopen Texas under Executive Order G18. The governor's added reopen services, as y'all experienced over the weekend, to those services that are allowed to be open. Those services include in-store retail, dine-in restaurants, movie theaters, shopping malls, museums, and libraries. For this first phase, reopen services must operate at no more than 25% of their posted occupancy. For more guidance on the checklists, the governor has issued Texans Helping Texans, the governor's report to reopen Texas, and that can be found on the city's website at amarilloalerts.com. Finally, we've received a lot of calls about businesses not complying with the governor's order. We've been responding to these calls through our environmental health department and through the fire marshal's office to educate those businesses. They've been very responsive. We have not had a situation where a business was not receptive to compliance. All businesses, as I said, have been very receptive to that outreach. That's all I have, Dave.
Thank you, Jared. This time we want to go ahead and open it up to direct questions from the media. If you have a question for an individual panel member or the panel as a whole, that's fine. Let me go ahead and start with, I think I have Ariana Martinez of Channel 10. Good morning, Ariana. How are you?
Hey, good morning. I'm good. How are you guys? For this one's probably for the mayor. What specific changes will we see now that the state and federal agencies are involved?
I think easily what we will have are more supplies, more testing kits, and then hands-on, just determining whether we need more nurses or more helping hands to actually conduct those mobile test sites and things like that. Those are potential things that I think we'll receive from them. In case Dr. Milton may jump in here, but the truth is that it's fluid. They're arriving today, and we will be in discussions. We know the issues that we have, and we're prepared to discuss those issues with them and see what their strategies are.
Perfect. And then how will you address the language barrier that exists with many meat packing plant workers?
So we're working on that, and that's certainly a consideration at all times. We have trusted and established pathways of communication, and so we intend to work through those pathways.
And I will say there are a couple of nonprofits in town or people who have just filled the role of building relationships with these refugee communities and the leaders in those communities. And so they do have established communication channels, and each one is different. But it's important for us to continue to use those existing channels and not try to create new channels right now. So I'm really grateful for those community partners and the way they've invested in caring for these refugee populations. They're our neighbors, and they're welcome here in our city. And I'm really thankful for those channels to already exist. We just have to use the relationships that we have with them.
Perfect. And how much do Tyson workers contribute to Potter County cases?
So all beef packing plants contribute about 41% of cases.
And those
so
are
those are, yeah, go ahead. So that would be all cases related to beef packing plants. We'll have more data as our epidemiologists pull out specific data.
And Casey, is it correct that that 41% represents mostly employees? it doesn't even, there might be some family in that 41%, but for the most part, it's just employees. So their family would be in a different category.
For the most part, but yes, it would be employees and their contacts. And so we're working to separate that data, and we'll have more information as time allows.
Perfect. And during this time, will the buses continue to run from Amarillo to JBS?
Transportation is one of the issues that we specifically identified in visiting with the CDC and DSHS. And so that's an issue that we're asking for their help on. The way the current system is, it crosses jurisdictional lines. And so it's very difficult for us without the help of the state really stepping in to address that. So that is one of the issues that's being discussed, and we're looking forward to hearing their strategy on it.
And transportation will continue because of the number of employees that live in Potter and Randall counties. The manner of that transportation or the volume of available transportation assets could change.
Perfect, thank you. And why are recoveries higher in Randall County compared to Potter County?
I think it's just related to when people get sick and when the timing of different things, and so we'll have additional recoveries today, and so we'll see as we're plugging those numbers in, we'll see those numbers change at 2:30 today.
Perfect. And last question: who will be the point of contact for the enhanced efforts, and who will be reporting cases during this new change with the federal government?
So we'll have a joint effort with the CDC and the Texas Department of State Health Services, and the Deputy Regional Director for the State Health Department here in Region 1 will be part of that team, as will I.
Perfect.
And the rest of our team will be, we'll all be working on that effort.
Perfect. Thank you.
Thank you, Ariana. This time we now want to go to, if I'm not mistaken, Roger Gray of Channel 7. Roger, how are you?
Doing well. Mayor, over the weekend, you talked about in your statement on Facebook about the this beginning with the packing plant. I assume that was a misstatement. Are you saying our problem here began at the packing plant up north?
Well, it all began in China, and so the semantics.
Well, yeah.
The semantics of where it began, I'm not really sure is a productive line for us to spend much time talking about. What we know is that it is in the city of Amarillo, and we do have significant community spread. We know that a large percentage of our cases are tied to employees who work in that environment. And I'm grateful that they've been willing to go to work. I mean, they are critical to our nation's food supply. So what we need is help in strategies and supplies and resources to keep them working, to keep the food supply open. And we need some assistance in strategizing the safest way to do that, both for our community and for those workers. And so I'm grateful the CDC has spoken specifically about other strategies they've seen successful across the nation. So looking forward to having those conversations with them as they arrive here today, because it's in our community. And so where we're spending our time trying to address it is going forward, how do we keep our community safe?
The publisher of the Moore County Journal pointed out over the weekend that just 2 weeks ago, our health department, along with the state, toured the plant up north, toured JBS, and pronounced their measures adequate. Did we know then they were a problem, and why did we give them a green light?
Well, first, that's outside our jurisdiction, so I'll let Jared speak to that. But clearly, anything that's happening outside of our jurisdiction is not in our authority to make recommendations to or to hold them accountable in any way. So,
yeah,
as
far as our visit to the JBS plant and to Moore County, that was at the request of representatives in Moore County. So we're providing input and some of our expertise to assist with that situation. There's no proclamation or declaration from Amarillo Area Public Health District or from the City of Amarillo regarding that. However, we are available to our neighbors in all of our neighboring counties to provide assistance and input where possible and where appropriate.
Can I comment? Can I comment on that as well? Of course, we're very interested because our hospitals have patients that are referred into our hospitals from those areas, and so Casey and I have been in discussions with those various facilities for a long time because we want to make sure they understand that we're seeing patients and our referral pattern is such that we could be overwhelmed if things weren't clearly delineated. And so they have been basically responsive with our conference calls, and that was a mutual decision that it may be helpful for everyone if we were to go up and take a look at that.
The question the publisher raised was if indeed there were problems at the plant, why wasn't something said about it from here, since we toured the plant as well? And why weeks later, after the governor's, quoting directly, the governor's reopened the state, sound the alarm? Why the CDC now?
Well, Mr. Gray, our numbers are going up inside the city of Amarillo, and that's really what we're concerned about. It's in a population that's vulnerable, and we want to do what we can to take care of the people inside the city of Amarillo. And so our energy and our request for help from DSHS and the CDC is directly related to the numbers that we have here in Amarillo and our desire to make sure that those people get the treatment and that the rest of our community gets the supplies we need to keep our community safe.
All right, that's all I have.
Thank you, Roger. This time we want to go to, if I'm not mistaken, Jack Kessler, KMR Channel 4. Jack, how are you?
Good, you?
Pretty good.
So this question is kind of maybe maybe to everybody. With the increase in testing, how many more cases are we projecting to see with the results that the CDC and all that are going to be testing now, overtaking?
I don't know that there's a way to predict that. I think that, as we do targeted testing in higher risk populations, we anticipate seeing additional testing. When we are targeted testing with symptomatic people, we expect to see additional positives. If we're testing large groups of asymptomatic people, it's hard to know. So I think that we do know that we will see increased numbers of positives. I think at this point, we're not exactly sure what those numbers will be, but our team stands ready to respond.
Yeah, and that's going to be a function of the number of tests that are actually administered to date. If you look at our number of positives, just over 1,000, the number of tests administered right at 5,000, that's about a 20% return. Now that's symptomatic people. So we've been very diligent to follow the guidance from CDC and from the state DSHS to test symptomatic people. As we start testing more asymptomatic people, that positive return rate will likely go down some, but since you're testing more people, we're going to have more positives.
And I know we've seen triple-digit increases in the number of cases in our area over the past several days. What does that mean for our area when it comes to the peak of cases? Are we in that peak now?
I think that's difficult to say, but I would say that we're not quite peaking yet. And what we'll be watching are the number of new cases over the next week or two. And I think we would know that in retrospectively when we peaked.
And are we seeing any places here in Amarillo with an increase of cases, or any other places?
Yeah, we have, anytime we have groups of people who are working or living in larger groups, then that certainly increases the risk. And so we do want to make sure that our community knows that as we're out and about and we're moving around more, that we need to be more careful and we need to be cautious because there is an increased risk as we move about more. And so we do have smaller when we have contact investigations, we do have some smaller clusters. And that is to be expected, because as people are together, then it can disease transmission can occur. But we want to make sure that our community knows that as we're moving about more, we need to stay 6 feet apart. We need to wear masks. We need to stay home as possible. And so those are good reminders as we're moving about more.
And as we've said before, that's the advantage of doing as much testing as possible. I mean, that's been our whole strategy this whole time, is to test as many people as we possibly can, and also try to keep our hospitals from being overwhelmed. And we've been successful thus far. This is what I would want as an ID doc, is to keep our hospitals functioning well and keep them well supplied and with a good morale, and then test as many people as we possibly can. So we're going to get that, and I'm excited about that.
And this is a question for Mayor Milton.
Jack, I'll just add on. I've heard Dr. Milton say many times that any situation that involves confined spaces is at a higher risk for disease transfer. And so any business where employees are working in confined spaces, even if they're a critical or an essential business. So basically every food supplier or every business in the food industry, if what is required to provide that part of the food chain is working in confined spaces, that's something that we want to be getting in front of rather than waiting for those numbers to show us there's a problem.
And this is a question for you, Mayor, or for Mr. Miller. Do we know where the CDC is going to be setting up? Are they going to be at the mobile testing site? How is that going to work when it comes to them testing?
Yeah, we're still working through all those details. We have access, we have space for them at the Civic Center. We also have space for them at the Tri-State Fairgrounds. So we're working that out today. They should be on the ground today, and all the other assets are expected to be on the ground by this afternoon.
I have no further questions. Thank you, guys.
Thank you, Jack. And this time we're going to go to Ramon Godoy, and I'm probably mispronouncing it, El Mensonero newspaper. Did I say that correctly? Dr. Godoy, are you there?
Yes, sir. You pronounced pretty good. You pronounced pretty good. Thank you.
I tried.
Good morning, everybody. I have a question. First of all, Mayor said 41% cases come from packing plants. Is that correct? Okay. Yes. Now, what is any protocol, anything going on about contact investigation? Who is handling and how is handling? And if you guys need help, you categorize by ethnicity, or where are those, or do you have any idea what is going on with contacts?
Yes, sir. So the Public Health Department here in Amarillo does all of the contact investigations, and our team is working 7 days a week to do that. So yes, we do contact investigations every day for each patient.
Okay.
And we are working on putting that data into a form that the citizens can see where the cases are across our city. And that's, IT has been working. They know that's an ASAP project. So, I mean, I'm asking about it every day. Is it ready? Is it ready? Is it up? So watching on the website, that is hopefully coming very soon.
Good. Now, the other question is, I am really concerned. I received several phone calls and several emails and social media. I'm going to share later on today some of those comments saying, let me read for you. It said, I'm sorry, no offense or discrimination meant, but typically those working in the meat packing plants are lower means and live in Potter County, and it would be willing to bet the majority of cases are related to outbreaks in the meat packing plants. Because we don't want a breakdown in the food supply, we are getting federal help to control. This is one of those social media messages, but several of those is because people who live in Potter County are poorer than people who doesn't live in Potter County. I think at this point it's really important from the mayor's office and City of Amarillo make a statement and say this is not related to economical class or social position or something related to that. This is a disease, this is a virus, and it's contagious. anywhere you are. This is the big difference between dengue, chikungunya, cholera, or any of those other diseases who are predictable. This one is not. This in 6 months or 5.5 months, we have thousands of people sick, 3 more million people sick, more than 300,000 people dead, and it's increasing. I think at this point, for the good sake of everybody, will be really important from the mayor's office and the city of Amarillo and the hospital district to make a statement about that and explain people. This is not social class related. This is not economical issue. This is just a disease.
Yes, sir. It is not. So the virus does not distinguish between people.
Mm-hmm.
However, people who work in conditions where there's large groups of people, or they live in places where there are large groups of people, are more at risk. And so I think that is just something to remember. And we're working very hard to make sure that people in those categories are safer.
Mm-hmm.
And I think it's important to emphasize that this disease is very contagious. And so once it begins to cluster up, then we're going to see it spread rapidly in whatever cluster that is. And I appreciate that you bring this point up, because it does give us the chance to say everyone that lives inside our city is valued and we have concern for. And certainly, I actually have additional concern for people who I would feel like are in a more vulnerable living situation, or maybe a more vulnerable population where their access to medical care, for whatever reason, is maybe not as strong as a different part of the city. So I am grateful for the chance to say that we value these neighbors. They are our neighbors, and we are concerned about them getting the care that they need. And that is part of why we have asked for the additional testing supplies, the additional resources from the state and the federal government. We want to protect our hospital capacity so that anybody that needs that care has that care, no matter what neighborhood they live in.
Okay. No, I have no further questions. Any help we can provide there, don't hesitate to call us.
Thank you, Dr. Godoy. We appreciate it. We have one more media member, David Gay of the Amarillo Globe News. David, how are you?
I'm fine. Good morning, everybody. I guess the first question that I have is regarding the previous statements made regarding the transportation of the workers from Potter County to Moore County. You said earlier, and please correct me if I'm wrong, that this was one of the things that you guys brought up to the CDC. Can you talk to me about, have they, I guess, tackled a similar situation regarding this transportation in the other places they have been regarding this virus, or have those discussions yet to occur?
We noted the challenge to them. They did not respond with what specific measures they took regarding transportation in, say, Greeley, Colorado, or South Dakota, or Nebraska, or the other places where they've had plant closures. They did reference that they have a number of methods that they used in those places that contributed to their ability to reopen. They want to put those into practice, the ones that are appropriate, so that we can avoid any closures in our area. But we don't know the specific measures they took.
Absolutely. And have you guys, over time, as the situation has gone on regarding this transportation, I mean, have any? Can you talk about the changes that have been made for these workers to be transported safely from the Georgia Street Walmart over to the JBS plant in Moore County?
I really think it's better for the company to speak specifically to the changes they've made operationally. They have made changes, but I think that question is better directed to them to answer specifics about that.
Okay, and I guess the last question that I have is, in the request that was made either to the state as well as the federal aid, were ventilators a part of that of those supplies being requested?
Yes.
All right.
It was certainly on the list. Yes, sir.
And the governor assured me that we would have all the ventilators we needed.
Absolutely. All right. That's all the questions I have. Stay safe, guys.
Thank you, David.
You too.
This time, that concludes our news conference. I want to thank all members of our panel who participate in this. Once again, we do it every Monday, Wednesday, and Friday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo. And we will see everybody on Wednesday. Thank you.
Thank you.